Well, hello and welcome to all of our gold viewers here today. I'm Fiona Lang Sharp, IBCLC Director of Communications and MC here at Gold Learning. Well, welcome everyone joining us here today. I'm very happy to say that I'm sitting down with Sarah Oakley, someone that I have personally wanted to talk to for a long time, Sarah. So I'm excited that you're here. Welcome to Gold Learning. And of course, you will be presenting at our upcoming tongue tie symposium here, which is very exciting. How are you doing today, Sarah?
I'm very well, thank you, Fiona. How are you?
I am very well. And of course, just had a little sneak peek of what you're going to be presenting at the conference, which we'll talk about in just a minute. Just to give everyone something to think about, though, this is the title: The Elephant in the Room, Bleeding Post Tongue Tie Division. Okay, so just want everyone to think about that for a moment because this is going to be a big topic. And I know that it's going to be great to have folks come together and really discuss this because bleeding is not something that we talk a lot about, is it, Sarah?
No, it isn't. I think it's something that as a practitioner we're all very aware of, and it's one of the things we all dread, but it's not something that is openly discussed. It's more discussed in small groups of practitioners when they get together rather than as an open topic that's put out there for general discussion.
That's right. That's right. All right. Well, let's put a pin in that just for a moment because, of course, I would love it if you could formally introduce yourself. So, why don't you tell all of our audience that are listening today where you are in the world and sort of what does your practice look like?
I'm based obviously in the UK, in a place called Ely, which is a little town. Well, it's a city actually. But it's a small city. It's got a cathedral, so it's got city status. But it's more of a market town in terms of size, about 20 miles north of Cambridge. So I'm in Cambridgeshire in the UK. But my practice actually covers a much wider area. I have clinics in Suffolk and Norfolk, which are neighbouring counties, and I draw clients in from other counties that surround Cambridgeshire, so Lincolnshire, Bedfordshire, Hertfordshire, and Essex as well. Because if people can travel to me, I'll see people from
Right.
pretty much anywhere, and I have people come from all over. I set my private practice up back in 2009 after working in the NHS for many, many years in community nursing and health visiting. And then when I qualified as a lactation consultant, I decided to set up privately, largely because the NHS trust I was working for wasn't particularly interested in using my lactation skills, and I felt there was a need for
Right.
them, and
Hmm.
I couldn't use them in my NHS role. I was doing volunteer work, but there's limitations with that. So I went into
Sure.
private practice. 2 years after starting private practice, I then trained at Southampton with Mervyn Griffiths and Carolyn Westcott, who are obviously big names in the world of tongue tie, to do scissor division. And that was really by popular demand. It wasn't something I set out to do. I kind of
Mm,
fell into it, and it was,
right.
a lack of services in my area that
Yes.
that led me to do that. And people were saying to me, why on earth don't you train to do it? Because there's such a need in this area, and people can't access that service, and they're having to wait several weeks to get that service, and the
Hmm.
service just wasn't kind of meeting the need. So that was how I ended up doing tongue tie division, really. It wasn't a kind of preordained plan or anything. In fact, a
Right.
few months before I trained, I told another IBCLC that I wouldn't be training to do division. I had no plans to. And then a few months later, I did. So,
And here we
yeah,
are.
yeah. And then it kind of took over my life, really.
Yeah. Well, here we are, and just reading through some of your bio today, over 4,000 procedures that you've now performed. That's a lot. Many families, obviously, that you have helped and been very successful with. I see that you have a book in the works as well, Sarah. So tell us a little bit about that.
Yeah, the book that I've got in the works has been commissioned by Pinter and Martin, who are a well-known publisher of books relating to pregnancy and birth
Hmm.
and babies and children and things. And it's part of the Why It Matters series, so it will be Why Tongue Tie Matters.
Hmm.
There's about 12 other books in that series at the moment covering breastfeeding and mothering and all kinds of topics. So that I was hoping that it would be done by now, but it's been stalled a bit by COVID. But I'm hoping to get that done in the next next couple of months, and then obviously there'll be a bit of a period before it gets published. But it's aimed at parents, but I'm hoping
Okay.
that practitioners will get quite a lot from it as well. So those
Sure.
Why It Matters guides are very much aimed at the parent market, but
Sure.
I'm writing it in such a way that I'm hoping, lots of people in the world of lactation will
Mhm.
get something out of it and learn from it too. So
That's
hopefully it will
fabulous.
be a useful addition to the books that are already out there.
Well, that's awesome. Well, you'll have to keep all of our gold delegates up to date on that release. Let us know, of course, when it's in the works, because they're really at this point, we're still hungry for information, and the more we can learn from each other, the better. So, and even those books that are predominantly for parents, they're actually really good for us to read too, because we get a better understanding of what the parent is looking for and what they're reading. And so I love reading those books too, just so that I know, exactly what is a good book for a parent, because they can also
Mm.
get so overwhelmed with the amount of
Mm.
information, right, Sarah?
Yes, definitely. I think that's one of the things that I've struggled a little bit with the book because um, you want to give quite a lot of detail, but then equally it's putting it in terms that are accessible to all parents, and
Sure.
also not getting too bogged down in the
Hmm.
the whole kind of, if you've done a lot of academic writing, it's all about backing it up with lots and lots of research and referencing, and
Yes.
and almost you can get lost in all of that, and
Mm.
I have to keep bringing myself back thinking, actually, yes, I need to be able to back up what I'm saying with some research, but that's not the primary purpose of this particular piece
Right.
of writing. It's to get information into parents really that needs to be research based, but doesn't have to be written in an academic way really.
Yeah, absolutely, absolutely. Well, it's exciting to hear the work that you're doing, and of course, with that upcoming publication as well. Like I said, we'll certainly keep our eyes open for that. Now, let's jump into the topic at hand, because, like you said, it's the elephant in the room. I love that title so much. The elephant in the room, bleeding post tongue tie division. And so I'm going to pose this question to viewers right now. Has it happened to you as a practitioner? It certainly happened to me, and I have to say that I was a little bit flummoxed initially, understanding that there should be no or very little bleeding. And when I had a client, it was very scary for them to see their child bleeding. So, Sarah, is that a normal? Is that what happens to practitioners today, like me? That we suddenly have a baby on our hands that's bleeding, and what is going on, because we're under the illusion that perhaps there shouldn't be or very little, as we've sort of been taught.
Mm.
Is that one of the things?
I think that's
Yeah,
still
sorry.
out there. Yeah, I mean,
Yeah, go
certainly
out.
for me
Yeah.
back in 2011 when I trained.
Mhm.
Yeah,
Yeah.
back in 2011 when I trained, I was very much led to believe that, I read the NICE guidance. The NICE guidance says very little bleeding, and I
Yeah.
was very much, and I was actually told in my training that, most if it does baby does bleed, it's for a few minutes, it's very light, it stops with a bit of pressure.
Mhm.
And in fairness, at Southampton where I trained, that had been our experience to that point.
Right.
Um, and so when it first, I'd only actually done about 30 procedures when I had my first significant bleed, and
Okay.
that was quite shocking. And
Mm.
at the time, we had no organisation, we had no association of tongue tie practitioners in the UK. There
Right.
was really nowhere for me to go with that apart from back to Southampton. I went back to Mervyn and chatted it all through with him and everything, and he was
Yeah.
very supportive. But when I spoke to other IBCLCs about it, I got quite a lot of negativity. I got told, you shouldn't be doing it in the community, it should be done in a hospital setting. Oh, we don't
Right.
believe in tongue tie, you shouldn't be doing it at all. There was quite a lot of angst around it. But I did have a couple of colleagues who were also doing divisions who actually came to me and supported me through that.
Mm.
But yeah, it was quite tricky. But even now, one of the reasons why I decided to do this presentation for Gold was because within the last year, I have seen conversations on some of the forums where
Right.
IBCLC is discussing cases where people have said, oh, I went to
Mhm.
visit a mum and her baby had a division done and they ended up, having to have adrenaline, blah, blah, blah. Is that normal? People are still not, aware that yes, it is unusual, but it is, it's not outside the realms of what we would
Right.
expect. We do expect some babies to bleed
Yeah.
more than others. But there was still that, sense of shock amongst the IBCLCs and breastfeeding counsellors and other people as well working with families. That sense of shock that they've seen
Yeah.
this baby that has had a bleed. So I think that was one of the reasons why I wanted to do the talk, really, to open up that whole discussion.
Yeah,
Because I think if you
absolutely.
read the literature, all the
Mhm.
most of the research studies will say oh, we treated 200 babies and there were no episodes of abnormal bleeding within that 200. So you kind of get the message that actually it's very, very rare, and
Hmm.
it is rare, but it happens. It's not
Right.
so rare that most of us are going to come across it. Most of us are supporting families where they're going for tongue tie division are going to have families that come back and report that this has happened to them. It's going to happen to all of us, I think, if we're seeing babies regularly.
Yeah, absolutely. So this is about being prepared and knowing what to do
Mm,
next, realistically, and
yeah.
sort of really understanding the whole element around what it might look like, what there is potential for, and then what can be done in a situation where there is bleed and how to really measure it. Is that correct?
Yeah, yeah. So it's to give people a kind of insight into, when does a bleed stop being within normal expectations and
Right.
become something else where you need to intervene and do other things other than just feeding the baby and putting pressure on and things. So,
Sure.
and people's perceptions of that are going
Hmm.
to are going to vary. Healthcare professionals will have a much higher tolerance for bleeding than a layperson will. And again, I do get stories coming to me of, oh, my baby bled terribly. And when you actually explore that, they bled for about 4 or 5 minutes and it was a trickle,
Right.
but, to that person that witnessed that parent, that's obviously quite a shocking experience. So it's about, I think we have to think not only how do we handle it if it happens,
Hmm.
but also preparing the parents for that eventuality as well. Because
Hmm.
my experience has been that if you've done a good consenting procedure and you've prepared them for that, then
Right.
at the end, if something does happen and they do bleed a little bit, they tend to cope better with it because they know that, well, yes, this does happen, and this is the steps that will be taken, kind of thing, and
Hmm.
it's not quite so shocking
Yeah.
as it would be if it came out of the blue. If you'd been led to believe that, oh, it'll be a drop of blood and you'll be going home and that'll be fine.
Yeah.
So yeah.
Well, that's good. Yeah, no, that's really good. It just reminds me, as you're talking, I'm thinking through the cases that I've seen over the years, and I do recall, like, the first case where, I've got a parent and she's calling and she's asking, she said, I can't get a hold of the practitioner and I need your help. And they were really close by to me. So she had actually traveled about 300 miles to get this initial
Gosh.
sternotomy done. And I was local to her. I was like literally 3 minutes from her house, and was, her IBCLC. So I was able to go in, but we patiently waited until we got a call back. And it did turn out to be normal. By the time I actually got to the house, the bleeding had stopped.
Hmm.
So that was a good indicator that we were, in a safe place. But I have to say, Sarah, that I had very little skill at the time, to really know or understand. And up until that point, like many practitioners and IBCLCs, did not know that, in fact, this could be a normal part of it, in some respects, and what to watch for. So I think it's fabulous that this is coming to light, that we're going to have some really good conversation about it, and some really, I mean, I know it can be controversial, so I hear that, and I want us to have a good debate and understand and look at the literature, to really get a good handle on this, because that at the end of the day, we want our clients to be safe.
Exactly, exactly. And we also want our practitioners to be safe too. We want
Absolutely.
practitioners to be prepared for this because when it first happened to me, I did feel very ill prepared for it.
Right. Yeah.
Even as a nurse, I dealt with bleeding as a nurse, so I kind of knew what to do. But even so, there was still that element of shock and surprise that this had happened.
Yeah. Yeah.
So,
Well, that's wonderful.
yeah, yeah.
That's so good. So this is going to be a really good conversation. So we want everybody to come and listen. Sarah Oakley is going to be live with us on Tuesday, September 15th. But check the time zone. So make sure that you go to our website at goldlearning.com, and you can now sign up for our tongue tie symposium. And Sarah's going to be with us live. So it's great when you can come to the live sessions, but because of course Sarah will be here answering your questions. We'll be discussing it together as well, with all of the delegates that are online. And if you can't make it, of course, you will be able to listen to the recording and listen to, of course, all the questions that came in. Sarah and I will be talking as well during that session so that we can get a really good handle on this topic as well. Thank you so much, Sarah, for joining us here today. It's been fabulous having you here.
Thank you for having me.
You're
It's been
very
nice to talk to
welcome.
you.
Yeah. And so just a quick reminder, all of our delegates out there, this is our Gold Learning Tongue Tie 2020 Symposium. You can join us for both days. So we are live on the 14th and 15th of September. Of course, check all the local time zones. You can go to our website right now at goldlearning.com and register for this fabulous conference. You can join us for one day or both days. We'll look forward to seeing you online. Don't forget to comment below as well. We can't wait to check in with you and see how you're doing and have a wonderful time here together learning all about tongue tie once again. Thanks for joining everyone today. Have a wonderful rest of your day. Bye bye for now.